Hey everyone, and welcome back to the channel. Right now, there's a massive spending bill moving through Congress, dubbed by some as the Big Beautiful Bill, that could fundamentally reshape American healthcare as we know it. But for millions of ordinary Americans, this bill isn't looking so beautiful. In fact, experts are warning it could lead to thousands of preventable deaths and trigger an unprecedented crisis for our hospitals, especially those in rural communities. Let's talk about what this means for you and your family. The proposed changes could strip health insurance from millions of Americans. We're talking about as many as 16 million people potentially losing coverage across the nation, with some estimates at 7.6 million or 7.8 million specifically losing Medicaid. This number could further increase with the expiration of Affordable Care Act premium tax credits. In states like New Mexico, over 90,000 residents could lose their Medicaid. And in Georgia, forecasts suggest about 310,000 might lose all insurance, with 56,000 specifically losing Medicaid coverage and remaining uninsured. A study by Harvard Medical School and Public Citizen even estimates that Nebraska alone could see 30,000 more uninsured people and 66 additional preventable deaths annually due to these cuts. Overall, analyses predict that more than 16,600 people could die annually as a result of losing access or foregoing care. The problem stems from things like new work requirements for Medicaid recipients, demanding up to 80 hours a month, even for parents with older dependents, and more frequent eligibility checks, shifting from once a year to every 6 months. This isn't just a bureaucratic hurdle, it's a roadblock for people who work seasonally or are between jobs, leading to large numbers of eligible people being unable to enroll. For example, Georgia's existing Pathways to Coverage program, a limited form of Medicaid expansion with work requirements, already struggles with low enrollment despite enormous expense. If these cuts pass, patients could lose access to primary doctors, struggle to afford essential medications, and skip critical screenings like mammograms. This leads to worsening health and chronic illnesses that patients will have to live with for the rest of their lives. This bill is also especially concerning for mothers. Nearly half of all births in Georgia and over half in New Mexico are covered by Medicaid. And nationally, almost half of rural births rely on it. For Black women, who are already 3 times more likely to die during childbirth than white women, these cuts could drastically worsen health disparities. Beyond individuals, the bill could impact over 65% of nursing home residents in rural counties who are covered by Medicaid. And the proposed reduction in provider taxes for nursing homes could jeopardize their operations and access to care. The impact on our hospitals, particularly in rural America, is nothing short of catastrophic. The American Hospital Association predicts a staggering $50.4 billion reduction in federal Medicaid spending for rural hospitals over the next decade. Many hospitals are already operating on razor-thin margins. In Wisconsin, hospitals could face a $3 billion spending reduction over 10 years, leading to $900 million in uncompensated care. Iowa hospitals could see a $4 billion cut over the same period. New Jersey stands to lose $19.2 billion in healthcare spending over 9 years, with $6.9 billion impacting hospitals alone, plus an additional $5 billion in uncompensated care for the newly uninsured. New York could face over $700 billion in proposed cuts to Medicaid, and Alabama hospitals, many already fragile, also warn of significant negative ripple effects from any funding decrease. A significant portion of these cuts relate to the Medicaid provider tax, a state-imposed fee on hospitals and other healthcare providers used to help fund a state's share of the Medicaid program. When states use these funds to boost Medicaid spending, the federal government matches the funds, effectively increasing overall Medicaid revenue. All states except Alaska utilize at least one provider tax. The Senate's version of the bill proposes gradually reducing this tax rate from its current 6% or less to 3.5% by 2031, with an exemption for nursing homes and intermediate care facilities. This is more aggressive than the House's version, which proposed freezing the rate at its current level. Proponents of the cuts argue that these provider taxes are a loophole or cash cow that states use to inflate Medicaid funding. However, hospitals contend these payments are essential, especially since states often pay so little for serving Medicaid patients compared to other types of insurance. When hospitals are legally required to provide emergency care regardless of a patient's ability to pay, these uncompensated costs pile up, especially if millions more Americans become uninsured. This directly threatens their survival. We've already seen 92 rural hospitals close in the last decade, with 16 more this year, and 1/3 of all rural hospitals are currently at risk of closing due to financial difficulties. 4 hospitals in Georgia, including Washington County Regional Medical Center and Irwin County Hospital, are specifically identified as at risk of closing services or shutting down completely. In New Mexico, 15 hospitals that heavily rely on Medicaid payments are deemed vulnerable, including Eastern New Mexico Medical Center and Rehoboth McKinley Christian Hospital. Some rural hospitals in Alabama, like Lawrence Medical Center and Bullitt County, have already closed inpatient services due to financial stress. Iowa also has 20 rural hospitals at risk of closure, with 5 facing immediate risk. These aren't just buildings, they're lifelines, providing critical services like maternity, behavioral health, and emergency care. If they close, people face longer travel times for care, sometimes 50 to 70 miles in rural areas, making minutes count in an emergency. This can be life-threatening, especially in areas with challenging terrain or weather. The consequences extend to healthcare jobs too. The industry has been a rare bright spot in our economy, accounting for nearly half of all jobs added in the U.S. in May. But these cuts could eliminate hundreds of thousands of jobs across the country, affecting not just medical staff, but entire communities where hospitals are often the largest employers. For instance, Connecticut warns of hundreds of thousands of jobs lost, and New York's 21st congressional district alone could see 2,600 jobs eliminated. In New Mexico, the director of nursing services for Albuquerque Public Schools stated that over 50% of their nurses could be lost if Medicaid funding is cut. The proposed cuts, totaling anywhere from $800 billion to over $1 trillion in federal Medicaid spending over the next decade, are intended, proponents say, to eliminate waste, fraud, and abuse within Medicaid and the Affordable Care Act. They argue they aren't cutting anything meaningful, but instead strengthening the program and saving it for the future. Yet critics point out that despite these cuts, the bill is still projected to add trillions to our national debt, potentially $2.8 trillion to over $4 trillion, largely to fund massive tax cuts for corporations and the wealthiest Americans. Even those with employer-based insurance could feel the sting, as hospitals facing revenue shortfalls might seek higher reimbursements from commercial insurers, leading to increased premiums and reduced benefits for everyone. This means that the bill is really going to cost all of us more. Furthermore, while President Trump has claimed the bill wouldn't touch Medicare, the projected deficits could trigger automatic spending reductions that would include cuts to Medicare. Specifically, changes to Medicare Savings Program, which helps vulnerable seniors and people with disabilities cover medical costs, could mean 1.3 million people lose these benefits, potentially leading to thousands of premature deaths. It's a complex web, but the bottom line is clear. When the overall healthcare system is strained, the quality and accessibility of care suffer for everyone, regardless of their insurance type. This bill is not just a policy debate, it's about the health and well-being of millions of Americans and entire communities. So there you have it. The big, beautiful bill could fundamentally alter healthcare access for millions of Americans, putting immense pressure on our hospitals and potentially leading to tragic consequences. This is a critical issue that demands our attention. What are your thoughts on these proposed changes? Let me know in the comments below. If you found this information valuable, please hit that like button, subscribe for more breakdowns of important financial and economic topics, and ring the notification bell so you don't miss our next video. Thanks for watching, and I'll see you next time.